So while I'm doing my video, I don't have anybody to do it on because I only have me that's available. So I've been doing the videos on me, so they've been fine to talk to my teachers and they said it's fine. So I'm just trying to do the best I can do to explain and show things of what I'm doing for my video. So I walk in the room, do some privacy, say, hi, my name is Taylor. I will be your nurse today, do my hand hygiene. And I'll ask what your name and date of birth is. Do you have any allergies? And then your pain scale from a 0 to a 10. And then where's the pain at? What's it feel like? Okay, so this procedure is really just an examination of your head, eyes, ears, nose, muscles, cardiac information, lungs, and stuff like that. It should only last about 15 to 30 minutes, and it shouldn't be that long at all. And I wanted to thank you for letting me do this procedure or examination on you. All right. So as I'm talking to my patient, I notice that she is not in any signs of acute distress at all. Her mood and her facial expression are all appropriate to the situation. Her dress is appropriate for her age and situation. Her behavior seems to be nice and appropriate for the situation as well while I'm talking to her. Her hygiene seems to be nice and intact. There's no abnormal smells. She seems to be nice, well-groomed, dress appropriate, and so forth. I asked my patient, do you know where you're at? Do you know the year? Do you know the situation that we're in? And do you know who you are? Okay, so then my patient is alert and oriented, times 4 to person, place, time, situation, and so forth. I don't see any signs of any assistive devices on them, like a cane walker, pacemaker, anything like that. Their speech is nice and clear. There's no slurring of their speech. There's no drooping, no signs of stroke or anything. So overall, their physical appearance seems to be nice and appropriate for their age and race and so forth. Next, what we're going to do is we're going to do vital signs. So while I do, first with the vital signs, I'm going to do temperature. So we're going to take temperature orally, sublingual, underneath the tongue. And then whenever I take the temperature of my patient has a 98.4 degrees temperature. Normal is 97.6 to 99.1, so it's within the normal range. Next, we're going to do blood pressure. So you put the blood pressure cuff right here around the brachial artery, and then you listen with your stethoscope and puff it up. So my blood pressure is a 120/80, which is in normal range for blood pressure. Next, I look at the saturation, O2 saturation, and my O2 saturation, or my patient's O2 saturation, is 99%. Normal is 95 to 100%, so that means I am in normal range. Next, for the vitals, you do the pulse. You get your pulse. So I'm going to use my left radial artery to get my pulse, and I use my 2 fingers right here to get my pulse. And I listen to that, or feel for that, palpate. While I'm doing that, I'm also paying attention to the respirations. So while paying attention to the respirations, I notice that her respirations are 14 breaths per minute, which is normal because normal range is from 10 to 20 respirations. After that, I am done palpating the pulse, and their pulse is at a 78 beats per minute, which is a normal range between 60 and 100 beats per minute, which is normal. So as I was taking the vitals, I see that my patient's skin color is appropriate for the race. It's nice, warm, dry. It's not wet, it's not perspirant or anything like that. There's no lesions or any type of scars, incisions, or wounds or anything. There are piercings on my ear. I do have tattoos on my arms as well, but the skin looks nice and appropriate for the race. Their skin turgor seems to nice and bounce back. There's no signs of like tenting or anything on their skin. Their nails, so I have my nails painted, but if you want to check for their capillary refill, you press down on the nail and let go, and the capillary refill should come back within less than 3 seconds. Also, the nail color looks nice and appropriate for the race as well. There's no signs of clubbing. The contour and shape looks nice and normal and within normal range, and so forth. And their shape of their nail has right here a shape of 160 degrees over with no signs of clubbing. So their nails and their skin looks good, and their vitals seem to be nice and within normal ranges. So next, after doing your vitals and skin, we're going to start from the head to toe. So next, we're going to do the head, neck, and face. So when we do the head, we start palpating the head for any masses, lesions, incisions, so forth like that. There's no infestations or anything of lice on the head. Then you look at the throat. We're going to look at the trachea and make sure the trachea is not deviated one side, that it's midline in the neck. There's no signs of pneumothorax if it was deviated to one side. So whenever you're testing the head, face, neck, you test 3 different cranial nerves. You test cranial nerve number 5, cranial nerve number 7, and cranial nerve number 11. So first we're going to do cranial nerve number 5, which is the trigeminal nerve. So there's 2 different things you do, the sensory and the motor functions of the nerve. So first is the sensory function we can use for taste. So you can have your patient close their eyes and take a bite of like a pickle, and they can identify it's a pickle with their taste. Or you could do like the prick point test or whatever, and or wait, was it the use a side of a cotton swab, take the cotton swab off and touch parts of their face, and they'll identify what was sharp part and what was the soft part of their face. So that's the sensory motor that shows that it's intact for the trigeminal nerve. Next, for the trigeminal nerve, you can do the motor function, which is the masseter and the temporal. So you can have your patient clench their jaw, and you'll be able to feel the masseter muscle and the temporal muscle be able to clench. So you see my finger moving. So my masseter muscle and my temporal muscles, they both are symmetrical, and they are both able to clench, and that shows that cranial nerve 5, which is trigeminal nerve, is intact for both sensory and motor. Next, for the cranial nerve, we do cranial nerve number 7, which is the facial nerve. Doing the facial nerve, you make sure the patient can puff their cheeks, smile, frown, and raise their eyebrows. If they can do all that, that means that the cranial nerve 7 is intact for the facial nerve. Next is the cranial nerve number 11. So cranial nerve number 11 is the accessory nerve. The accessory nerve is the function of moving your head back and forth and moving your shoulders up and down. So whenever you do this, you have you put your hand here and have your patient move their head with resistance. So don't let me push your head this way. So I push against it, and I push against it. And then don't let me push your shoulders down and raise them up, and I push against this. Don't let me push your head this way, and then push this way. Don't let them push that way. So that shows that you can do that with resistance, that the cranial nerve 11 is intact, which is the accessory nerve. And then also, whenever you look at the trachea, there's no types of masses or anything. I think I said that already. But there's no type of masses or lesions or cuts or anything on your neck. Okay, so next we know that the cranial nerves 5, 7, and 11 are all intact. Next, we move to the eyes. Okay, so I'm going to take my glasses off. As you look at the eyes, you notice that the sclera is nice and white and moist. There's no signs of discharge or drainage or redness or anything. The conjunctiva is nice and pink and moist. Sclera is nice and clear. And there's no signs of discharge or anything with the eyes or redness also. So, and then you also look at the eyelashes and then the eyebrows and the eyelids. There's no signs of swelling, redness, discharge, edema. The hair is all distributed evenly with no infestations or anything like that. So when assessing the eyes, you want to assess for PERLA, which is pupils are equal, round, resistant, reactive to light, and accommodative. So when you look at my pupils are equal, round, and they're symmetrical. Reactive to light is whenever your pupils dilate and constrict with light. I don't have a pen light, so like whenever I close my eyes and let my pupils dilate and open them up, they constrict. So that means that they're reactive to light. Last is accommodation. So accommodation is where you can look at something that's close up and then look in a distance to make sure your eyes accommodate to that. So I'm going to look at this. I'm going to look at this first and then at my phone. Look at this on my phone. So if I can do that, that note shows that my eyes are accommodation. So my eyes are, my pupils are equal, round, reactive to light, and accommodative. So whenever you assess the eyes, you assess cranial nerves number 3, 4, and 6, which is the oculomotor, the trochlear, and the abducens nerve. So when you do the trochlear, oculomotor, and abducens nerve, you do the 6 cardinal directions of gaze. So when you do this, you gotta make sure your patient looks down, to the corner, to the side, corner, up, corner, to the side, corner, and back down. So it's the 6 directions of the eyes. You make sure your eyes are both following it symmetrically. You don't have one eye drooping, you don't have one stagnant or fixed facing forward. That means that the cranial nerves 3, 4, 6, oculomotor, trochlear, and abducens nerves are all intact. So eyes look to be nice and healthy. Next, after doing eyes, you look at the ears. So looking at my external ear right here, you notice I do have earrings in. There's no cuts, bruises, scars, lesions, or anything, just holes in my ear from where I got my ears pierced in. When you look at the external canal, there's no type of drainage or lesions or any cuts, bruises, or anything like that, or so forth. Whenever you assess the ears, you have to make sure you assess cranial nerve number 8, which is a vestibulocochlear nerve. When you test the vestibulocochlear nerve, you test the motor function, or the function of it with the whisper test. When testing the whisper test, you'll go into your patient's ear and you will say one thing like A, B, C, and they'll respond saying you said A, B, C. Go over to the left ear and I'll go 1, 2, 3, and they'll say that they notice that I said 1, 2, 3. So them repeating what I whispered in their ear, that shows that the cranial nerve 8, the vestibulocochlear nerve, is intact. So their exam of the ear seems to be nice and healthy within ranges, and their cranial nerves are all intact. Next, what we're going to do, we did the eyes, ears, now we're going to do the nose. So the external nose seems to be nice and symmetrical with all the rest of my facial features. It's centered in my face with no cuts, lesions, scars, or anything on my nose. I don't see any types of deformity. It's all symmetric on both sides, and there's no inflammation on my outer nose. When you look at the inner nose right here, my nares, bilateral patency is present. There's no drainage, no deformities. No, it's all symmetric, no asymmetry, no inflammation, no redness, nothing like that with my nose. So my external nose seems to be nice and intact. If you also want to test a cranial nerve that has to do with your nose, you can do the olfactory nerve, which is the smell. So you can put like coffee grounds under your patient's nose and have them identify the smell with their eyes closed. It's not exactly with the nose, but it's just with the smell because you use your nose for smell. So next what you do, we did the eyes, ears, nose, so now we're going to do the mouth. So looking at the mouth, first we're going to look at the lips. So my lips are nice and pink and moist. There's one little cut right here, but there's no other signs of lesions or anything like that. My tongue and mouth is nice and pink and moist. My gums are nice and pink and moist with no signs of gingivitis. Looking at my palate and my buccal mucosa, as nice and pink and moist as well. My teeth look nice and healthy with no periodontal disease present. That's perfect. So when you test the mouth and throat, you always test for cranial nerves 9, 10, and 12, which cranial nerves, it's the glossopharyngeal nerve, the vagus nerve, and the hypoglossal nerve. When testing the glossopharyngeal nerve and the vagus nerve, we can do it together. So when you test this, you look at their patient's uvula in the back when they say ah, 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 and you see that it goes up and down. That means that my gag reflex is intact, so that the cranial nerve 9 and 10 are intact for that. Also, when I'm talking or swallowing, it shows that cranial nerves 9, glossopharyngeal, and 10 vagus are intact. Next, what we do is that we can test cranial nerve number 12, which is the hypoglossal nerve. When you test the hypoglossal nerve, you're testing the movement of your tongue. So the movement of my tongue, I can move it around, and I can move it around with resistance and stuff, and there's no deviation of my tongue. So that means my cranial nerve 12, my hypoglossal nerve, is intact. So my mouth and throat seems to be nice and healthy with everything intact, and my cranial nerves all with no deformities. Next, what we do is we do the eyes, ears, nose, mouth. We move down to our respiratory system. So doing the respiratory system, you have to first look at the anterior chest. When looking at the anterior chest, you see that my anterior chest is nice and symmetrical, and when I'm breathing, I'm not using any type of accessory muscle use like bringing up my shoulders and helping my diaphragm push up my lungs and having helping me be able to talk and breathe. So next, whenever we do the respiratory system, we assess the lung fields of your body. So when you doing it anterior, you can assess the right middle lobe, but when you're doing that posterior, you can't get the right middle lobe. So first, we're going to oscillate and listen to the lobes. You always start with in a Z formation and make sure you're doing it on bare skin. So doing this, I'm going to start with the right upper lobe. Doing the right upper lobe, we go underneath the pit and it's a little back here. And whenever you do this, have my patient breathe in and out. And then go to the left upper lobe, my pit right here. All right, and then you go to the right middle lobe. So when you're right here, it's like a little triangle box with them. So this was the right upper lobe, now we're going to the right middle lobe, which is in more. All right, and you go to the left lower lobe. This is our left upper, and then we're going to the left lower. Okay, sounds good. And then we're going over here to either the right upper, right middle, now we're doing the right lower. So while I was doing that, I didn't hear any signs of brute or anything, and so forth. It seems to be nice and normal lung sounds. So forth, didn't hear any abnormalities or anything like that. While I was doing the anterior lung sounds, I have to now do the posterior lung sounds. So doing the posterior lung sounds, there is no right middle lobe that you can also take from the back. So while doing this, I'm going to do the lobes. I'm going to do it on my bear. So posteriorly, I start with the right one. So I go right here. Here's the right lung. Have them breathe in and breathe out. Now we go to the left lung. Breathe in, breathe out. Right lower lung. Breathe in, breathe out. And then go to the left lower lung. Breathe in, breathe out. All right. So lobes seem to be nice and normal breath sounds. I don't hear any signs of brute, no wheezes, no crackles or anything like that with the lung sounds and so forth. And when I was doing the posterior lung sounds with the lobes, their curvature of spine seems nice and normal. There's no signs of lordosis, kyphosis, or scoliosis at all. So the respiratory system seems to be nice and intact. I don't have any abnormalities or anything with their breathing. Next, after doing the lungs, we have to do the cardiovascular system. So doing the cardiovascular system, first we're going to check and palpate the carotid pulses. When you palpate the carotid pulses, you use your two fingers, tips, and you do them unilaterally, one at a time. And you do this at a 45-degree angle with your patient laying back. So when I'm feeling this, I don't feel any types of thrill. You can also listen to it. When you auscultate your carotid, you listen for a brute. So I don't hear any signs of a brute at all. All right, and as I was doing that, I can also see that there's no jugular vein distension that is present. There's no signs of edema as well. So then next we're going to do the pulses. So I'm going to check my left and right radial pulse. Use my two fingertips right here and do my artery right here, and I feel for it. And I notice that my left radial pulse is at a 2+ with no bounding. I go over to my right hand. I check my right radial pulse. It's at a 2+ as well. So then next, after doing my radial pulses, I'm going to do my dorsalis pedis pulse, which is on top of my foot. On top of my foot right here. And my pulse is at a 2+ on my left. Then my pulse is at a 2+ on the right. After doing the dorsalis pedis pulse, we're going to do the posterior tibialis pulse. So then the posterior tibialis pulse is right here. And that's at a 2+. And then on my right foot. And then my posterior tibialis pulse is at a 2+ as well. So my pulses seem to be nice and strong with 2+ with no bounding pulses. So now what we're going to do is we're going to also take the heart sounds. So whenever I also take the heart sounds, I'm going to listen to the valves of my heart. So I'm going to use the diaphragm of my stethoscope first to listen to it. So then first what we're going to do is we're going to listen to the aortic valve, which is the second right intercostal, left sternal border right here. And it's a nice strong pulse. So next we're going to do the pulmonic valve, which is the second left intercostal, left sternal border. And the pulse is nice and strong. So next we're going to do the Erb's point. Erb's point is the third left intercostal, left sternal border. We go down one. So the pulse here is nice and strong. Next we do the tricuspid valve. With the tricuspid valve, I asked my teacher and she said it's on the 5th intercostal. But whenever I look in my book says the 4th intercostal. So I'm going to go with my book. So I go down one to the 4th intercostal, left sternal border. And my pulse seems to be nice and strong there. So next for the mitral valve. So when you do the mitral valve and you have a female, you always want to go under the breast a little bit to the 5th intercostal, left mid-clavicular line, so mid-clavicular from your clavicle. And my pulse is nice and strong for that. And then also you would also do that with the bell of your stethoscope as well, and do it all over with the bell and listen to the bell. All right, so our chest seems to be nice and healthy. There's no signs of thrill or brute with our carotid or with our chest. No signs of wheezing or anything with our respiratory, and it seems to be nice, all intact. So next what we're going to do, we're going to test the gastro and the urinary part with our abdomen. So with our abdomen, our color of our abdomen seems to be nice and appropriate for our race. The contour and symmetry is nice and symmetrical. There's no types of distended abdomen, no bruising, no lesions, nothing like that. Okay, so it looks to be nice and healthy and symmetrical, color good, contour good. So first we're going to do is we're going to listen to the bowel sounds. So when you listen to the bowel sounds, you always start with the right lower quadrant. Starting with the right lower quadrant, you listen. Then we're going to go up to the right upper quadrant, left upper quadrant, and left lower quadrant. And I hear good bowel sounds with that. They're all normal, no hyperactive, no hypoactive bowel sounds. And then you would palpate. You always palpate after you also take your bowel sounds. And then you feel if there's any tenderness or distended bowel or anything. Then you can also ask for the last bowel movement and then pain with urination or how often they urinate and so forth. So their abdomen seems to be nice and intact and normal contour and symmetry, and bowel sounds are good and normal, no signs of hyper or hypoactive bowel sounds. So next we're going to do the joints and the muscle range of motion. So first we're going to inspect the upper joint size of our shoulder. So our upper joint size of our shoulder seems to be nice and symmetrical. The contour of it seems to be like nice and smooth and bilateral throughout both. They're both symmetrical. I don't see any abnormalities. Then we're going to look at the wrist. Looking at the wrist, I see that my wrists are nice and symmetrical. The contour of my wrist seems to be nice and even and smooth, and they're both equal bilaterally on my joints on my wrist. So then next we're going to do our lower extremities, which is our hips and our feet. So our hips are here. Our hips, the contour and symmetry seem to be nice and smooth and even bilaterally with no abnormalities or lesions or cuts or anything like that on our hips. The joints seem to be nice and equal and smooth and symmetrical, both bilaterally. Next, our feet. So our feet right here, looking at our ankles, our feet. And our feet, both of our feet, we can look at them with our joints and stuff around them. And they're both equally symmetrical. Their contour is nice and equal and smooth, both bilaterally as well. With our feet. No abnormalities or anything with their lesions or anything on the feet. So they're both symmetrical, contours even, smooth, and both bilaterally. Next, what we are going to do is we are going to assess the range of motions of our upper extremities. So we're going to assess the range of motion of our elbows. So extension, flexion, moving them out, up, back, forward, just moving them everywhere. It shows that we have full range of motion bilaterally of a 5+ for our elbows. Next, we're going to do our neck. So our neck, move it around in a circle, move it down, up. Shows that our neck, we have full range of motion bilaterally at a 5+. Next, we're going to do the lower extremities. We're going to do the knees. So knees, extend, flex, move in and out, inversion, inversion. It shows that we have a nice, even range of motion bilaterally with a 5+. And then lastly, we're going to do our ankles. So with the ankles, with the dorsiflexion and plantar flexions, we're going to do eversion and inversion and rotating it. We have nice, even range of motion bilaterally with a 5+. So our joint size in our upper extremities, lower extremities, and so all look nice and normal, symmetrical, contour good, all bilaterally. Range of motions all 5+ with our upper and lower extremities of our parts of a major and minor part of our body. Lastly, so our function of our lower extremities seems to be nice and strong with the 5+. No abnormalities, no shuffling or anything with their gait. Their gait and coordination seem to be nice and smooth and even. No shuffling, no leaning, no signs of kyphosis of like and bending your head back and try to like compensate for it. The gait and coordination seem to be nice and even and smooth. Function of the lower extreme and upper extreme are both very 5+ and even and strong. And then our muscle strength also for our upper and lower extremities are both nice and strong. No abnormalities, no signs of any kind of deformities or anything with our muscles around there. So our whole muscles and joints seem to be nice and good with a 5+ bilaterally, all symmetrical, and their contour seems to be nice and healthy. So I just want to thank you for letting me do this examination. I'm going to do your pain scale again from a pain from 0 to 10, 0 being non-existent to 10 being the worst you've ever felt. Okay, so what I'm going to do now is I'm going to lower your bed to the lowest it is. I put your bed rails up. Make sure your call light is on the side of you right here and even and nice in reach. And then I just want to thank you again for letting me do this for you. And then if you need anything, just let me know. And I do my hand hygiene. And thank you.